Hi, my name is Laura Montgomery, and today I'll be doing a presentation on the eye with how the eye is made up, what makes up the eye, and then 3 diseases that can happen in the eye. So our eye is an organ for sight. It has several components which include external, middle, and internal structures. Some external structures are the conjunctiva, which is the thin layer underneath the eyelid. It's a transparent mucous membrane that covers the inner surfaces of the eyelid and extends over the sclera. The cornea, which is this area right here, is a clear dome-shaped surface that covers the iris and the pupil. It allows light to enter the eye, and due to the dome-shaped, it helps refract or bend the incoming light rays to help focus them on the retina. The sclera, which is the white part in the eye, it is the fibrous connective tissue layer that protects the eye and helps maintain its shape and structure. The sclera extends from the cornea to the optic nerve. Some middle structures of the eye are, one is the iris, which is the colored part of the eye. Mine is brown since my eyes are brown. The iris is a colored part of the eye that helps regulate the amount of light that enters. It has a small round opening in the middle, which is the pupil, and that's where the light comes in and out. The pupil is the black circular dot in the middle of the iris that determines how much light is let into the eye. The pupil will constrict with a lot of light and dilate with less. The ciliary body, which is this area here, is the part of the eye that produces the aqueous humor. It contains the ciliary muscle and ciliary processes and is located behind the iris. It contains the ciliary muscle helps the eye focus by changing the shape of the lens to refract light onto the retina. The ciliary process makes the aqueous humor for both anterior and posterior chambers. The choroid is a thin, blood-rich membrane that lies between the retina and the sclera and is responsible for supplying blood to the outer portion of the retina. Some internal structures of the eye. The lens, which is also called the crystalline lens, is a transparent biconvex structure located behind the iris. The primary function of the lens is to change shape to alter the focal distance of the eye. It works with the cornea to refract and bend light. The lens changes shape by action of the ciliary body as part of accommodation, a process that allows a person to focus. An example of accommodation is the ability to focus on near objects such as reading. Suspensory ligament of the lens is a series of fibers that connect the ciliary body of the eye with the lens, holding it in place. The retina, which is the nerve layer and in the back of the eye, senses light and creates electrical impulses that travel through the optic nerve to the brain. Neurons make most of the retina, which is why the eye cannot regenerate if destroyed. The retina converts images into a form that the brain can understand and process as vision by way of rods and cones. Rods and cones convert light to neutral signals, which the nervous system translates into vision. The choroid is a thin, blood-rich membrane that lies between the retina and the sclera. It is responsible for supplying blood to the outer portions of the retina. The macula is the most sensitive spot in the center of the light-sensitive retina in the back of the eye. The macula is responsible for visual acuity, central vision, and color vision. It is what allows us to see fine details clearly and as such as 20/20 vision. The optic nerve is a bundle of more than 1 million nerve fibers carrying visual messages from the retina to the brain. It is the second of 12 cranial nerves and is often referred to as the optic nerve or called cranial nerve number 2. There are other cranial nerves associated with the eye, which are cranial nerve 3, which is the ocular motor, cranial nerve number 4, trochlear, and cranial nerve number 6, the abducens nerve. And all can be assessed in the eye by using a pen light and having the patient follow the light to all 4 quadrants of the nose towards the nose. The normal optic nerve function is to send signals from the eye to the brain, working as a messenger to help us determine what we see. The optic disc is the area on the retina where the nerve fibers come together to become the optic nerve as it leaves the eye to connect the brain. Vitreous body, a clear jelly-like substance that fills the middle layer of the eye that makes up the largest part of the eyeball, 80%. The fluid is mostly water and helps the eyeball keep its shape. And 3 diseases that are associated with the eye and most common in the elderly. So glaucoma, which is the second leading cause of blindness and is a disease that damages the optic nerve in the eye. This disease can cause permanent vision loss. It is not a rapid disease. It develops slowly and usually no warning signs until years later. The most common type of glaucoma is Poag, primary open-angle glaucoma. In Poag, the outflow of aqueous humor is decreased in the trabecular meshwork. The drainage channels become clogged, much like drains in a sink, resulting in optic nerve damage. The significant manifestations of POHD is tunnel vision, a loss of all peripheral vision. The second form of glaucoma is AACG, acute angle closed glaucoma, which is due to reduction of outflow of aqueous humor that results from angle closure. Usually this is caused by the lens bulging forward because of the aging process. Angle closure may also occur because of pupil dilation in a patient with anatomically narrow angles. Patient with AACG will experience sudden pain in or around the eye, nausea, vomiting, and visual symptoms such as seeing colored halos around lights, blurred vision, edema of the cornea, ocular redness, and increased intraocular pressure, or IOP. The primary focus of glaucoma therapy is to keep intraocular pressure low enough to prevent the patient from developing optic nerve damage. AACG requires emergency treatment. Nurses should stress the importance of early detection and treatment in preventing visual impairment by having routine eye exams. Medications are required for both forms, usually a medicated eye drop or oral medication. Nurses should teach patients with POAG about topical drops such as Myostat, which can decrease visual acuity by meiosis, particularly in dim light. So it's important to teach patients with POAG to be careful with dim lit areas. It is important to educate the symptoms of allergic reactions, especially those with sulfa allergies, and patients should be educated on how to properly administer drops by not touching the eye. Macular degeneration, age-related macular degeneration, AMD, may cause central vision loss, which is what is seen looking straight ahead. This disease will affect simple tasks such as driving and reading. It is caused by deterioration of the macula, the small area in the center of the retina in the back of the eye. However, it does not affect peripheral vision. There are 2 forms of macular degeneration, wet and dry. The most macular degeneration cases start as dry, but 1 out of 10 people will progress to wet stage. Wet AMD is more severe and affects 1 out of 10 already affected by dry AMD. Much like retinal detachment, eye dilation is done to check the retina. Age is the #1 cause of macular degeneration. The nurse should assess the patient's ability to see and perform ADLs. It is essential with age-related macular degeneration to have adequate lighting to perform ADLs efficiently and safely. Decreased vision acuity can increase confusion in elderly patients, and some patients in early stages may be a candidate for laser surgery, which the nurse can provide information on. The nurse should encourage the patient to see an ophthalmologist annually to monitor vision acuity and to look for any complications in the eye. And thirdly, cataracts, a widely occurring eye problem and usually affects more than half of all Americans over the age of 65. They usually have visual impairing cataracts in 1 or both eyes. It's when the eye forms clumps and prevents the eye lens from sending information to the retina. Cataracts are usually seen as the formation of dense, cloudy areas in the lens of the eye. When this happens, light is simply unable to pass through the retina, and the victim is unable to clearly see objects in front of them. Common symptoms of cataracts are blurry vision, colors may appear faded, heavy glares on headlights, lamps, or sunlight may be too bright, and this may cause them to see halos around the lights. Poor vision at night, double vision, and frequent prescription changes in their eye lenses. Cataracts usually develop slowly, and unfortunately there is no way to prevent them. However, the nurse can educate the importance of new glasses, brighter lighting, anti-glare sunglasses, or magnifying glasses to help with vision. Surgery is also an option, but not always successful. It involves removing the cloudy lens and replacing it with artificial lenses. Wearing sunglasses and a hat with a brim to block ultraviolet sunlight might help delay cataracts. The nurse can also stress the importance of certain dietary needs, such as consuming vitamin C and E and avoiding unnecessary radiation exposure. Thank you.